State of Illinois taxpayers paying up to $550 million for health care subsidies to those in the country as non-citizens over the age of 65, but years prior, it included people over the age of 42 who were in this country undocumented. Well, some changes to the program that's subsidized by taxpayers brought up during a Illinois Healthcare and Family Services hearing yesterday with advocates trying to push for changes to allow for even more people to come in, and also pushing back on the idea of copays that the Pritzker administration has brought forward as part of a change for the new fiscal year. Welcome back, Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and Talk. So you have this advocate group, several different groups, experts and individual Illinoisans, and even some migrants that were organized by the Healthy Illinois campaign. They took to a hearing with the Illinois Department of Healthcare and Family Services yesterday. Now, the plan that they discussed, advocates were pushing for some changes because, as I mentioned, the history of this, back in 2020, the state opened up healthcare subsidies for undocumented migrants in Illinois. For those over the age of 65, they would get healthcare subsidies, essentially. Then in 2022, I believe they opened it up even further to allow for those over the age of 42 and up to get healthcare subsidies paid for by Illinois taxpayers. And this would be for the undocumented non-citizen migrants in the state. So in the past year, we've had now what's the number? Is it 16,000? How many? I forget how many migrants we've had come from just the southern border from Texas in the past year. But what is it? 12? No, it's 13,000. I think is what it was. But you have these newly arrived migrants as well. You know, families that are coming here with maybe the clothes on their back, maybe a backpack with some personal items. But if they're over the age of 42, they were looking at possibly getting subsidized health care coverage. But then there was a study. Earlier this year, it was talked about an audit of sorts that looked at the cost to taxpayers, and it showed that the cost was ballooning to more than $1 billion. This is back in 2020, whenever they first implemented this for 65 and over. I think the estimated cost was just several $1 million. But obviously that has ballooned, especially when they expanded it in 2022 to include those 42 and over. It's ballooned to an estimated cost of $1.1 billion. So as part of the budget process that the State House put together in the spring session, that budget set to start July 1st, which was a month and a half ago or so, a little over a month ago. 2 months ago, was September 6th now. So you have the new state budget that was enacted, and Governor J.B. Pritzker, he changed the program through emergency rule after being given the ability to do so by the state legislature. And essentially what his new policy is, no longer is it 42 and up, now it's only just 65 and up. So 65 and up, but there's a cap on how much it's going to cost taxpayers at $550 million. Plus, he's implementing copays as part of the rulemaking process here. So what are those copays going to cost? It range from $100 for emergency room visits, $250 per patient for hospitalizations. So obviously, there's going to be some costs to the non-citizens taking advantage of this program. But yesterday, to air out all of the various things within this program, you had advocates and experts talk about the various issues. Nadine Israel, she's with the AIDS Foundation. She says that she understands the financial barriers that there are involved with the plan, but she hopes to work with Governor J.B. Pritzker and others to find some resolution to all of this.
Healthy Illinois recognizes the fiscal realities facing our state and wants to work with the Pritzker administration, HFS, and all stakeholders to find solutions that efficiently use taxpayer dollars to accomplish our shared goals of healthcare coverage for all.
And others were there as well, including public comments from individuals, including migrants and other groups. The Illinois Coalition for Immigrant and Refugee Rights Edith Avila Olay, she was there and says that she worries that the copay that the governor instituted as part of his emergency rules are going to be a burden for those migrants taking advantage of the program.
Based on our experience in working with hospitals, we don't feel comfortable with this assumption. It's very likely that patients will receive medical bills that they cannot afford. And we do have a question, like what will patients do when they are billed incorrectly?
So as this hearing was going on with the Department of Healthcare and Family Services, a virtual hearing to lay out some of these rules, the Chicago Sun-Times reports that the department sent out a notice to providers writing that copays, quote, have not been implemented yet and cost sharing from providers should be completed before patients are asked to dole out copays or co-insurance. So again, you had the governor's office saying that copays should never have been charged during the emergency rules period anyway, according to the Chicago Sun-Times. So obviously the cost is there and taxpayers picking up the bill. How much the federal government could provide, from my understanding, it was nothing. But there might be some federal dollars that could be provided. But Republican state representative from Mildstadt, State Representative Kevin Schmidt, he talked to my reporter Andrew Hensel, and he laid out some of what he says are a lack of priorities here. So here's Kevin Schmitz just with some of his thoughts on the ongoing costs to taxpayers for undocumented migrants.
I don't think that we should be spending money on immigrants that are here illegally.
So he says they're here illegally. Others would say that some of those, especially most recent, the 13,000 or so in the past year that have come across the border and transported to Chicago, they're here illegally because they claim asylum. They cross the border and they say, I fear for my life back in my home country. Don't know exactly what the script is, but that makes them a legal asylum seeker. So you get into this kind of war of words: illegal, not illegal, asylum seeker, non-citizen, undocumented migrant, illegal immigrant, all of these different words that you can obviously parse out and make different arguments about. But Schmidt says that the $550 million set aside for this program for non-citizen healthcare, that really should be used from others.
I think, obviously the big elephant in the room is to possibly put a large chunk of that down towards paying off the pension debt.
So the pension debt, it's what, $140 billion of unfunded liability. So Schmidt, he says, instead of paying for non-citizen health care, they should put that type of money towards the pension debt. But advocates say that if you don't have this health care program and allow for these migrants to go and see the doctor, they likely will end up in emergency rooms, costing taxpayers even more from having to cover the emergency room coverage that wouldn't be paid for elsewise. So it's an ongoing debate, and I don't think we're done hearing about this because there are some of the concerns that have been raised as to whether or not this program is going to be sustained, if the money is going to continue to be there. Earlier this summer, there was a hearing with, I believe it was the Joint Committee on Administrative Rules, and they tackled this with the issue of possibly running out of funds and reaching that $550 million budget cap by this fall. So, again, we'll likely be hearing more about this in the future. Who knows? Are lawmakers going to have to come back and deal with this during veto session and maybe pass a supplemental appropriation? We'll see what happens, but we'll keep it here and keep you posted as well. So we talked last segment about the ongoing cost of migrant health care that Illinois taxpayers are subsidizing, but what about the housing costs? That's costs tens of millions of dollars, and up in Chicago, it's continuing to cost. Yesterday, we talked with reporter William Kelly to get a view of the lay of the land on the Chicago streets. Well, he was on Chicago streets recently, and he uploaded this onto his Twitter account, William J. Kelly at X, so you can find him. Just search William J. Kelly. But he went to the Standard Club, where there was video recently shot of a fracas of sorts of what's alleged to be migrants clashing with others. And he was trying to get some answers as to if the Standard Club's getting tax dollars to house these migrants. So here's a little bit of that video of William J. Kelly trying to get some answers on the streets of Chicago yesterday.
This is reporter William J. Kelly in Chicago. This shocking video reveals what is taking place at the once famous Standard Club of Chicago, which has been turned into a high-end luxury migrant shelter. As a lifelong Chicagoan, I could not believe that this video was shot in Chicago, but it was. I am going to ask the people who are running this migrant shelter what they think of the violence that is being committed by the migrants and if the taxpayers of Chicago should be footing the bill.
So, again, it shows him going into the shelter to ask some questions. He asks some questions, but he eventually is shown out and is told that he can't record in here. He says in his Twitter post that the manager of Chicago's Standard Club got very upset, and that's a quote from William Kelly's post, saying, "She scolded me. There is no, 'Hi, sir, are you listening?' Following the process, and you can't record in here." He says, "I can record in that taxpayer-funded migrant shelter because the people of Chicago have a right to know what's happening there, and because that's what reporters, good ones, do," Kelly says on Twitter. So I'd encourage you to go check that out if you are have continued interest in this. And of course, I mean, the state of Illinois has spent tens of millions of dollars just in the housing. You've got the city of Chicago spending tens of millions of dollars in housing, and that's expected to be re-upped. And how this all is going to be dealt with, especially with the idea of possibly moving some of these migrants, again, 13,000 of them just in the past year, moving these migrants to some of the areas of the suburbs. All of this while you've got state officials like Governor J.B. Pritzker and others, including members of Congress, asking for the Biden administration to offer up work visas for those recently arrived migrants who are awaiting an asylum hearing. And what's interesting here is questions raised there are, they're not going to be properly vetted like others who get visas are properly vetted, because there's a process to vet and to make sure that these individuals are here in a legitimate capacity, and there's safety concerns and more. But obviously, this is an issue that's going to continue to be sustained in front of everybody's face, and I think we'll obviously be talking about it again in the near future.